Welcome back, future nurses. Today, you're taking on a hard-level pharmacology SATA challenge, designed exactly like the next-generation NCLEX. These questions focus on high-risk medications, toxicity, and antidotes, for drugs, critical safety alerts, select all that apply, SATA, only. This is where many students fail, but you will pass. Grab your notebook. Stay sharp. Let's begin with question 1. Question 1. A client is receiving digoxin. Which findings require immediate provider notification? Select all that apply. A. Apical pulse of 52 bpm. B. Serum potassium 2.9 milliequivalent/L. C. Nausea and vomiting. D. Blurred yellow vision. E. Blood pressure 138/84 mmHg. Correct answers, A, B, C, D. Rationale: bradycardia, hypokalemia, GI distress, and visual disturbances are classic signs of digoxin toxicity. Strategy: digoxin problems equals low pulse, low potassium, GI plus vision changes. Question 2. Which medications increase the risk of serotonin syndrome when combined with SSRIs? Select all that apply. A. Tramadol. B. St. John's wort. C. Sumatriptan. D. Ondansetron. E. Diphenhydramine. Correct answers, A, B, C. Rationale: these drugs increase serotonin levels and may lead to life-threatening serotonin syndrome. Strategy: too much serotonin equals fever, agitation, tremors, hyperreflexia. Question 3. A client is receiving a heparin infusion. Which findings indicate possible bleeding or HIT? Select all that apply. A. Coffee ground emesis. B. Hematuria. C. Platelet count 48,000/mm superscript 3. D. Bruising at 4 sites. E. Blood pressure 142/86 mmHg. Correct answers, A, B, C, D. Rationale: GI bleeding, hematuria, thrombocytopenia, and unexplained bruising indicate heparin complications. Strategy: heparin equals low platelets plus bleeding equals stop. Question 4. Which laboratory findings require the nurse to hold the next dose of warfarin? Select all that apply. A. 4.9 Indian rupees. B. Hemoglobin 8.7 g/dl. C. Platelets 290,000/mm superscript 3. D. Black tarry stools. E. PT within normal limits. Correct answers, A, B, D. Rationale: high INR, anemia, and melena indicate life-threatening bleeding. Strategy: warfarin plus high INR plus bleed equals hold. Question 5. Which medications require apical pulse assessment before administration? Select all that apply. A. Digoxin. B. Metoprolol. C. Diltiazem. D. Furosemide. E. Amiodarone. Correct answers, A, B, C, E. Rationale: these medications directly affect heart rate and rhythm. Strategy: if it slows the heart, check apical pulse. Question 6. Which findings indicate opioid overdose? Select all that apply. A. Pinpoint pupils. B. Respiratory rate 8 per minute. C. Blood pressure 82/50 mm of mercury. D. Agitation. E. Shallow breathing. Correct answers, A, B, C, E. Rationale: opioids suppress the CNS, causing respiratory depression, hypotension, and pinpoint pupils. Strategy: opioids equals low breathing plus tiny pupils. Question 7. A client is receiving 4 vancomycin. Which findings indicate toxicity or infusion reaction? Select all that apply. A. Hearing loss. B. Red flushed face. C. Tinnitus. D. Hypotension during infusion. E. Hyperglycemia. Correct answers, A, B, C, D. Rationale: ototoxicity and red man syndrome are major vancomycin complications. Strategy, vancomycin equals red skin plus ringing ears. Question 8. Which medications require renal function monitoring? Select all that apply. A. Vancomycin. B. Gentamicin. C. Metformin. D. Lithium. E. Acetaminophen. Correct answers, A, B, C, D. Rationale, these medications are renally excreted and become toxic with kidney failure. Strategy, kidney drugs equals check creatinine. Question 9. Which drugs increase the risk for QT interval prolongation? Select all that apply. A. Amiodarone. B. Haloperidol. C. Erythromycin. D. Digoxin. E. Ondansetron. Correct answers, A, B, C, E. Rationale, these drugs delay cardiac repolarization and may cause torsades de pointes. Strategy, QT drugs equals ECG plus magnesium watch. Question 10. Which medications are classified as high alert medications on the NCLEX? Select all that apply. A. Insulin. B. For potassium. C. Heparin. D. Digoxin. E. Acetaminophen. Correct answers, A, B, C, D. Rationale, these medications cause instant death if dosed incorrectly. Strategy, if the dose is wrong the patient is gone. Question 11. Which findings indicate lithium toxicity? Select all that apply. A. Coarse tremors. B. Confusion. C. Polyuria. D. Slurred speech. E. Blood glucose 140 mg per deciliter. Correct answers, A, B, D. Rationale, neurologic symptoms such as coarse tremors, confusion, and slurred speech indicate lithium toxicity. Strategy, lithium toxicity always presents as neuro first. Question 12. Which medications require peak and trough monitoring? Select all that apply. A. Vancomycin. B. Gentamicin. C. Heparin. D. Digoxin. E. Insulin. Correct answers, A, B, D. Rationale, vancomycin, aminoglycosides, and digoxin have narrow therapeutic ranges requiring level monitoring. Strategy, if it can easily kill, always monitor levels. Question 13. Which drugs are strictly contraindicated in pregnancy? Select all that apply. A. Isotretinoin. B. Warfarin. C. ACE inhibitors. D. Acetaminophen. E. Valproic acid. Correct answers, A, B, C, E. Rationale, these drugs cause severe fetal malformations and pregnancy loss. Strategy, pregnancy equals N-O-warfarin, N-O-retinoids, N-O-ACE, N-O-valproate. Question 14. Which findings indicate theophylline toxicity? Select all that apply. A. Tremors. B. Tachycardia. C. Seizures. D. Drowsiness. E. Hypotension. Correct answers, A, B, C. Rationale, theophylline overstimulates the CNS and heart causing tremors, tachycardia, and seizures. Strategy, theophylline equals narrow margin for death. Question 15. Which medications increase the risk of bleeding when combined with warfarin? Select all that apply. A. Aspirin. B. NSAIDs. C. Ciprofloxacin. D. St. John's wort. E. Vitamin K. Correct answers, A, B, C. Rationale, antiplatelets, NSAIDs, and antibiotics increase warfarin effect and bleeding risk. Strategy, warfarin plus anything that affects clotting equals bleed. Question 16. Which are early signs of insulin-induced hypoglycemia? Select all that apply. A. Diaphoresis. B. Tremors. C. Hunger. D. Fruity breath. E. Polyuria. Correct answers, A, B, C. Rationale, hunger, sweating, and tremors occur first before neurosymptoms. Strategy: cold, shaky, hungry equals low sugar. Question 17. Which medications can cause orthostatic hypotension? Select all that apply. A. Prazosin. B. Furosemide. C. Nitroglycerin. D. Propranolol. E. Metformin. Correct answers: A, B, C, D. Rationale: vasodilators, diuretics, and beta blockers reduce blood pressure with position change. Strategy: first dose hypotension equals alpha blockers. Question 18. Which findings indicate neuroleptic malignant syndrome, NMS? Select all that apply. A. Lead pipe rigidity. B. Fever. C. Autonomic instability. D. Hyperreflexia. E. Elevated creatine kinase. Correct answers: A, B, C, E. Rationale: NMS causes muscle breakdown, hyperthermia, and unstable vitals. Strategy: hot plus stiff plus confused equals NMS. Question 19. Which medications must be administered through a central line only? Select all that apply. A. Total parenteral nutrition, TPN. B. Potassium 4 push. C. Vasopressors. D. Chemotherapy. E. Normal saline. Correct answers: A, C, D. Rationale: TPN, vasopressors, and chemotherapy destroy peripheral veins. Strategy: if it can burn the veins central only. Question 20. Which drugs cause photosensitivity? Select all that apply. A. Tetracyclines. B. Sulfonamides. C. Amiodarone. D. Prednisone. E. Metoprolol. Correct answers: A, B, C. Rationale: these drugs increase UV sensitivity leading to severe sunburn. Strategy: think, antibiotics plus heart rhythm drugs equals sunburn. Question 21. Which findings indicate digoxin toxicity worsened by hypokalemia? Select all that apply. A. Ventricular dysrhythmias. B. Yellow vision halos. C. Nausea and vomiting. D. Muscle weakness. E. Hyperglycemia. Correct answers: A, B, C, D. Rationale: low potassium increases digoxin effects causing lethal dysrhythmias, GI distress, and visual changes. Strategy: low K plus digoxin equals deadly combo. Question 22. Which medications require slow 4 administration to prevent cardiac arrest? Select all that apply. A. Phenytoin. B. Potassium chloride. C. Vancomycin. D. Calcium gluconate. E. Ketorolac. Correct answers: A, B, C, D. Rationale: rapid infusion causes fatal hypotension and dysrhythmias. Strategy: fast potassium equals fast death. Question 23. Which drugs increase the risk of Stevens-Johnson syndrome? Select all that apply. A. Carbamazepine. B. Lamotrigine. C. Sulfonamides. D. Ibuprofen. E. Allopurinol. Correct answers: A, B, C, E. Rationale: these medications can cause life-threatening skin necrosis. Strategy: new rash plus high-risk drug equals stop MED. Question 24. Which medications cause bone marrow suppression? Select all that apply. A. Chemotherapy agents. B. Clozapine. C. Methotrexate. D. Ibuprofen. E. Zidovudine. Correct answers: A, B, C, E. Rationale: these drugs suppress WBC, RBC, and platelets infection and bleeding risk. Strategy: low labs plus chemotype drugs equals marrow failure. Question 25. Which medications have a narrow therapeutic index? Select all that apply. A. Digoxin. B. Lithium. C. Phenytoin. D. Theophylline. E. Ceftriaxone. Correct answers: A, B, C, D. Rationale: small dose changes cause toxicity. Strategy, if levels are drawn narrow index. Question 26. Which medications can cause hyperkalemia? Select all that apply. A. Spironolactone. B. ACE inhibitors. C. ARBs. D. Furosemide. E. Potassium supplements. Correct answers, A, B, C, E. Rationale, potassium-sparing and RAS-blocking drugs raise serum potassium. Strategy, anything that spares potassium watch K. Question 27. Which drugs may cause respiratory depression? Select all that apply. A. Morphine. B. Benzodiazepines. C. Barbiturates. D. Tramadol. E. Ondansetron. Correct answers, A, B, C, D. Rationale, CNS depressants suppress the respiratory drive. Strategy, opioids plus benzos equals stop breathing. Question 28. Which medications are true antidotes? Select all that apply. A. Naloxone. B. Protamine sulfate. C. Flumazenol. D. Vitamin K. E. Epinephrine. Correct answers, A, B, C, D. Rationale, these reverse opioid, heparin, benzodiazepine, and warfarin overdose. Strategy, NCLEX loves antidote matching. Question 29. Which medications increase the risk of GI ulceration and bleeding? Select all that apply. A. NSAIDs. B. Corticosteroids. C. Aspirin. D. Warfarin. E. Omeprazole. Correct answers, A, B, C. Rationale, these damage the gastric mucosa and inhibit clotting. Strategy, pain plus steroids plus aspirin equals bleed risk. Question 30. Which findings indicate amiodarone toxicity? Select all that apply. A. Pulmonary fibrosis. B. Blue-gray skin discoloration. C. Vision changes. D. Hypothyroidism. E. Hyperglycemia. Correct answers, A, B, C, D. Rationale, amiodarone damages lungs, thyroid, eyes, and skin. Strategy, amiodarone equals toxic to everything. Question 31. Which medications must be held before surgery to prevent life-threatening complications? Select all that apply. A. Metformin. B. Warfarin. C. Insulin glargine. D. Oral contraceptives. E. Levothyroxine. Correct answers, A, B, D. Rationale, metformin increases lactic acidosis risk, warfarin increases bleeding, and oral contraceptives increase clot risk perioperatively. Strategy, before surgery stop bleeding and clot drugs. Question 32. Which antibiotics are nephrotoxic? Select all that apply. A. Gentamicin. B. Vancomycin. C. Tobramycin. D. Penicillin. E. Amikacin. Correct answers, A, B, C, E. Rationale, aminoglycosides and vancomycin damage renal tubules. Strategy, mycins attack the kidneys. Question 33. Which medications can cause gynecomastia? Select all that apply. A. Spironolactone. B. Cimetidine. C. Finasteride. D. Metformin. E. Digoxin. Correct answers, A, B, C, E. Rationale, these drugs alter sex hormone balance leading to breast tissue growth in males. Strategy, hormone-blocking drugs breast changes. Question 34. Which medications can worsen asthma or trigger bronchospasm? Select all that apply. A. Propranolol. B. Aspirin. C. NSAIDs. D. Albuterol. E. Metoprolol. Correct answers, A, B, C. Rationale, non-selective beta blockers, aspirin, and NSAIDs can induce bronchospasm. Strategy, asthma plus beta blockers equals bad. Question 35. Which medications should never be crushed? Select all that apply. A. Enteric-coated tablets. B. Extended-release tablets. C. Sublingual tablets. D. Elixirs. E. Effervescent tablets. Correct answers, A, B, C. Rationale: crushing destroys controlled absorption and causes toxicity. Strategy: AC, ER, SL equals never crush. Question 36. Which medications require baseline and ongoing liver function tests? Select all that apply. A. Statins. B. Acetaminophen. C. Isoniazid. D. Methotrexate. E. Digoxin. Correct answers, A, B, C, D. Rationale: these drugs are hepatotoxic and can cause liver failure. Strategy: if it hurts the liver, check LFTs. Question 37. Which medications significantly increase the risk for serious infection? Select all that apply. A. TNF-alpha inhibitors. B. Corticosteroids. C. Chemotherapy agents. D. Tacrolimus. E. Metoprolol. Correct answers, A, B, C, D. Rationale: these drugs suppress immune function. Strategy: if immunity is suppressed, infection is guaranteed. Question 38. Which medications can cause metabolic acidosis? Select all that apply. A. Metformin. B. Topiramate. C. Acetazolamide. D. Sodium bicarbonate. E. Aspirin, Toxicity. Correct answers, A, B, C, E. Rationale: these drugs increase acid production or bicarbonate loss. Strategy: formin plus toxic aspirin equals acid. Question 39. Which medications can cause esophagitis if taken improperly? Select all that apply. A. Doxycycline. B. Alendronate. C. Potassium tablets. D. Ferrous sulfate. E. Ibuprofen. Correct answers, A, B, C. Rationale: these pills burn the esophagus if the client lies down after taking them. Strategy: always sit upright with these meds. Question 40. Which medications cause dangerous sedation and respiratory depression when combined? Select all that apply. A. Opioids. B. Benzodiazepines. C. Alcohol. D. Antihistamines. E. SSRIs. Correct answers, A, B, C, D. Rationale: all are CNS depressants and suppress breathing when combined. Strategy: opioids plus benzos plus alcohol equals death trio. Question 41. Which medications prolong bleeding time? Select all that apply. A. Aspirin. B. Clopidogrel. C. Heparin. D. Warfarin. E. Vitamin K. Correct answers, A, B, C, D. Rationale: antiplatelets and anticoagulants interfere with clot formation and increase bleeding time. Strategy: if it affects platelets or clotting, bleeding risk. Question 42. Which medications can cause urinary retention? Select all that apply. A. Anticholinergics. B. Tricyclic antidepressants. C. Antipsychotics. D. Beta blockers. E. Diphenhydramine. Correct answers, A, B, C, E. Rationale: anticholinergic effects decrease bladder contraction leading to urinary retention. Strategy: anticholinergic equals can't PEE. Question 43. Which findings indicate magnesium sulfate toxicity? Select all that apply. A. Loss of deep tendon reflexes. B. Respiratory depression. C. Bradycardia. D. Hyperreflexia. E. Decreased urine output. Correct answers, A, B, C, E. Rationale: magnesium depresses the CNS and heart, toxicity causes absent reflexes, slow breathing, and reduced renal output. Strategy: if reflexes disappear, stop magnesium. Question 44. Which medications increase the risk for tendon rupture? Select all that apply. A. Ciprofloxacin. B. Levofloxacin. C. Prednisone. D. Doxycycline. E. Amoxicillin. Correct answers, A, B, C. Rationale: fluoroquinolones weaken tendons, and corticosteroids worsen the risk. Strategy: quinolones plus steroids equals SNAP risk. Question 45. Which medications cause severe birth defects if taken during pregnancy? Select all that apply. A. Isotretinoin. B. Thalidomide. C. Warfarin. D. Phenytoin. E. Omeprazole. Correct answers, A, B, C, D. Rationale: these drugs cause major fetal malformations and pregnancy loss. Strategy: pregnancy plus warfarin or retinoids equals disaster. Question 46. Which medications are associated with ototoxicity? Select all that apply. A. Vancomycin. B. Gentamicin. C. Furosemide. D. High-dose aspirin. E. Metoprolol. Correct answers, A, B, C, D. Rationale: these drugs damage the auditory nerve leading to tinnitus and hearing loss. Strategy: ending in mycin plus Lasix equals hearing damage. Question 47. Which medications can cause hyperglycemia? Select all that apply. A. Corticosteroids. B. Thiazide diuretics. C. Atypical antipsychotics. D. Beta blockers. E. Insulin. Correct answers, A, B, C. Rationale: these drugs increase insulin resistance and glucose production. Strategy: steroids and psych meds equals high sugar. Question 48. Which medications require ECG monitoring? Select all that apply. A. Amiodarone. B. Digoxin. C. Sotalol. D. Verapamil. E. Cefazolin. Correct answers, A, B, C, D. Rationale: these drugs affect cardiac conduction and rhythm. Strategy: if it slows or controls the heart, monitor ECG. Question 49. Which medications can cause severe rebound hypertension if stopped abruptly? Select all that apply. A. Clonidine. B. Beta blockers. C. Amlodipine. D. Propranolol. E. Hydralazine. Correct answers, A, B, D. Rationale: sudden withdrawal causes extreme sympathetic stimulation. Strategy: never stop clonidine or beta blocker suddenly. Question 50. Which medications require slow for administration to prevent fatal dysrhythmias? Select all that apply. A. Potassium chloride. B. Magnesium sulfate. C. Phenytoin. D. Vancomycin. E. Calcium gluconate. Correct answers, A, B, C, D. Rationale: rapid infusion can cause cardiac arrest and profound hypotension. Strategy: fast electrolytes equals fast death. Great job making it through all SATA only pharmacology NCLEX questions, hard version. Remember, consistent practice is the key to NCLEX success. If you found this video helpful, don't forget to like, subscribe, and hit that notification bell so you never miss another high-yield review. Drop a comment with the next topic you'd like to see: cardiac, endocrine, priority questions, anything you need, I've got you. Until next time, keep studying, stay confident, and I'll see you in the next video. You've got this, future RN.